Okay, so we're going to get started. Is everyone ready? Okay, awesome. All right, so our next presenter is Quinnipiac University.
Thank you guys. So I'm Andrea, this is Sam and Elise, and we're from Quinnipiac University. So our clinic is the Vision Clinic, Volunteers in Service, impacting our neighborhood. And we've been a clinic for about 2.5 years, so we just wanted to give you guys an update on what we've been up to. So for this presentation, we want to look at the good, the bad, and the ugly, discuss what's worked, what absolutely hasn't worked, and explore what's great and still works for you. So a little bit about Vision. Vision was started by 2 physical therapy students in 2011. In 2012, we saw our first patient, and that was in the spring, and by the fall of 2012, we became interprofessional with both physical therapy and occupational therapy students. So it's a student-run pro bono clinic. It serves individuals in the greater New Haven area who are either uninsured or have pesky care, or have exhausted their insurance benefits for a specific health condition.
Okay, so first the good. We're going to talk about interprofessionalism, the resources we have, our client diversity, the systems, leadership, and administration, and our fundraising. So for interprofessionalism, like Andrea said, we've been interprofessional for over a year now with OT and PT. Our treatment teams are 2 OT students and 2 PT students. We have the OT and the PT each in their last year, and then either 1 or 2 years younger, so that way they're getting that mentorship. And we also have an OT and PT faculty there at all times in order to treat between both licensures there with us. Our e-board is also completely interprofessional, and in the future we might be expanding to other professions, but at this point we are working with this model and trying to make it the best it can be before we do so. So our resources are great. We are very grateful for this. We have a lot of physical space because Quinnipiac just built a new campus, and the health science building is beautiful. We operate also out of the lab room, but the lab room has dividers and pretty much everything we would need to transform it into a clinic space, and we've been able to do that pretty quickly now, which is nice. We also have a model apartment, which is a fully functioning apartment. Obviously no one lives there, but it has a bathroom, a kitchen, a bedroom, a washer and dryer, and this way we are taking those clients into that area and having them practice the things that they need to be doing at home there, so we know exactly what's going wrong and what they need help with. We also have a budget, which is partially from the beginnings grants that we have gotten, and since that has been kept up with fundraising. And we have lots of therapy equipment, pretty much anything that Quinnipiac has, they've let us put our hands on, which is really nice of them. And we have an incredible faculty support. I'm not going to go through who all of our faculty are, but we have people that have expertise in all different areas. So when we have a question about something involving neuro, we know exactly who to go to. One of our professors is very big, and 2 of our professors are very big into legal. We have one that has a law degree aside from her occupational therapy degree as well. So we have all those resources. So not only do they come in with us when we're treating, but they are also very willing to help us. Our client diversity has grown a lot since the last time we were here. Last year we saw much more low back pain, chronic knee pain, a lot of ortho type things. And now we have our first client who has a spinal cord injury, which has been really amazing to be able to work with him, work on toilet transfers, and everything that he really needs to be doing at home. So our diversity has grown a lot, which has been really great for our students to be able to see some different things. For systems, we have changed a lot about how we operate, especially as a board, in the past year. We created a Google Doc. I don't know how many of you are familiar with Google Docs, but they are a lifesaver. And basically, as there's a picture of it later, but the way we have it set up is we have a lot of different tasks and due dates for tasks, so everyone always knows what's going on and what they're in charge of doing. So this way it kind of cuts out some of the unnecessary text and the frantic nature of what's going on. And then we also had an e-portfolio created, which has, at this point, pretty much every document we've ever used is in one place and is accessible on the internet to anyone in the Quinnipiac community. So this way, if we are running out of something and don't have time to get them printed or to go get the original, we all have access to that. We can all pull it up and print it out. It has all of our protocols and everything there, so this way there's kind of no questions asked. And then this is a screenshot of what our e-portfolio looks like right now. It has each position, and then under each position, it's description of the position, what their goals are, and any type of paperwork that they would need at any point, and resources that they would need. For leadership and administration, we have all gotten pretty into all the leadership aspects of this because we believe that that's going to help us run more smoothly. Those pictures are from the new board retreats and team building type things, and how we orient and transition everyone is kind of how we keep our clinic running. So we keep people excited, we make sure we're doing strategic planning and all of that, which is nice because we have faculty members that are experts in that also that are helping us constantly. So those are some of the things that are going really, really well. Fundraising, we are, in a couple of weeks, we're having a fundraiser called the Battle of North Haven, and what we're doing is we're pinning all of the professions on the new campus against each other for some friendly competition, and we're going to have a big kind of silly field day type experience. It's our first time doing it. We're really, really excited about it. And what we're going to be doing during this time is, like I said, playing those games. And a lot of that is about raising awareness of that we're on the campus, getting everyone on the campus excited about it. We also do bake sales, which are really successful, especially at sporting events. People are very into hockey and basketball at Quinnipiac, and our teams do pretty well. So we purposely set up our bake sales there because it brings in so much more money because we have the Hamden community coming, all the local community coming, and all the students coming, and who doesn't want a brownie. We also have a gala that we do with the PT students in their final year, during which faculty and students pay for this pretty much semi-formal dance, and at the dance we have raffle baskets, which also bring in a lot of money. So that's pretty much how we've sustained our funds thus far.
So we've titled the bad some of the things that haven't worked, but we feel also are slightly out of our control. So they include the name of the clinic, our location, referrals, and the timing of the clinic. So vision. We often run into issues with eyesight clinics. We've had clients call and ask if they can get their glasses fixed. That's not us. So it was a great acronym, but as people continue to just call it vision, we're running into a lot of problems with that. So we're currently reworking our logo to hopefully use vision as more of a slogan instead of the actual name of the clinic. The location. So Quinnipiac University is located in suburbia, Connecticut, in an upper middle class area. So the patient population that we're trying to target in New Haven is about 25 minutes away. So transportation seems to be a huge issue because oftentimes they don't have cars, and it takes over an hour and a half by bus route to get from New Haven to our campus. Also, Quinnipiac's insurance doesn't let us practice off of campus. So unless we were to take out our own insurance and practice in New Haven, we can't leave campus. And also parking. Quinnipiac just built a brand new medical school and is building a law school, all on the same campus that we operate from. So parking is a nightmare. There are 14 different entrances to the building, so trying to track down the patients, give them good solid directions as to how best to access the clinic has been quite a struggle. So this is the list of referrals. Haven and Wednesday Evening Clinic are both associated with Yale's medical school. Haven is our #1 referral source. They operate on a Saturday morning from Yale's medical students, and they often send us all their PT and OT referrals. Project Access is the same, and then Health Track, Baylor Hospital Outpatient, and local clinics and hospitals. We're really targeting the patients who have run out of insurance benefits with these people. insurance isn't what it used to be, so people are running out of visits a lot sooner. So we're hoping to be able to tap into that population since we're having a little bit of a difficult time with the communication population. And the timing. Our clinic is open Tuesday evenings from 4 to 8 p.m. And sometimes that just doesn't fit into people's life schedule. But based on class schedules and professor schedules, this was the best time for the clinic at campus.
So the ugly. The ugly are obstacles that we have defined as obstacles, and we are in the process of brainstorming how we can work to improve them. One of these is communication, both within the board, from the board to the faculty, faculty to faculty. So lots of communication barriers that we've run across. Interpreter etiquette, leadership, and volunteer morale. Communication. This is a screenshot of the Google Doc that Sam had mentioned earlier. As you can see along the left side is the board position. In the pink color is the directors. And then to the right of that would be a task that we've decided at our weekly meetings that they're going to accomplish. And then in the next column is the director who's going to oversee that task. So there's 4 directors, 2 OT and 2 PT. And for each position, each task, one director is going to oversee that task. So that board member knows which person to go to if they run into an obstacle. And it helps with our communication a little bit. And then we were having trouble getting people to get the task done by a certain time, so we decided to implement due dates, and then you initial the task when it's completed. Interpreter etiquette. Often our clients do not speak English, so we have a lot of interpreters, but the problem with that is they're not trained interpreters. So we are hoping to sort of create some sort of module that they can become competent to treat. It's very important when you're working with an interpreter to be looking at the client and talking to the client, even though you're talking through an interpreter. You want the client to feel comfortable with you, even though you may be speaking a different language. Leadership. So we've had kind of a little bit of difficulty with giving and receiving constructive criticism. We all know that we can all improve and nobody's perfect. So we have developed a form that we are going to meet with every person on the board twice this semester. And the sheet has areas of strength and areas that you feel like you can improve. And so we're going to go over it twice a semester. And then there's also a spot for them to tell us what we can do better to help facilitate their growth and the clinic's growth. Volunteer morale. We started out last year with over 100 volunteers and less than 10 patients. So we were kind of stuck. It's kind of the opposite problem that we're finding a lot of other clinics having. So trying to understand that vision is more than just clinic time. Vision is more than just Tuesday nights treating a client. There's a lot of educational opportunities. Even though we can't treat off campus, we can still educate off campus. So we've done a lot of creating brochures, going out into the community and spreading awareness about the clinic. We also have fundraising opportunities about the Battle of North Haven. So, in summary, you've realized that there are lots of hurdles that you have to come across to be able to get to where we are. But with networking opportunities like this, we can brainstorm ways to make the clinic successful. Does anybody have any questions? Yes?
Why did you decide on an e-portfolio instead of a website? Are you kind of using it as a website?
Yes. So the e-portfolio currently is sort of like an internal website. It's just for the clinic's use. We are working towards creating a website for people to find us, or we were talking about earlier during lunch, started creating a website off of Clinic University's website, so maybe prospective students or younger students just entering the OT and PT programs can be aware of this opportunity as they grow older. We've had a couple of clients walk into the clinic and say they found our website online, but we don't have a website. So we're hoping that will help with referrals in the future as well. So we don't know where that came from. And yes?
What do you think truly motivates your students to participate in the clinic?
I think it depends. I think it depends on the student. I know for the OT side of things, like occupational therapy student, we go to field with level 1s every semester, but on the PT side, they're just doing clinic visits once or twice a semester. So this gives them a lot more hands-on experience. On the OT side of things, a lot of our fieldworks aren't necessarily with this population or aren't in this type of setting, or we might be at a school and we want to be working with adults, and it's a lot of really good experience, especially going into our fieldwork level 2 is like everyone that I've ever talked to that has volunteered with us felt far more comfortable going into a clinical setting, and I think word of mouth of that has been the biggest motivator to be in the clinic at this point.
Thank you.
Also, the clinic teaches a lot of skills that you can't learn in the classroom. Developing rapport, interview skills, not being nervous when you're testing range of motion, something simple that you've been deemed competent in, but haven't done it on an individual who may have a disability. So it's a lot of those unteachable skills that people are able to learn.
We're having trouble with also our volunteer morale as well. What do you do when your patients don't show up? Like, how do you keep your student volunteers motivated to keep coming back to the clinic?
Honestly, we have lost some volunteers for that reason, but for the volunteers that do love it, they are our champions, and we love them for it. There are times where that has happened, but we've been running into that problem less, partially because I think we've tapped into a different population at this point a little bit.
Kind of along with the volunteer morale, an issue we're having is class scheduling. We've tried to approach all of our advisors that schedule our classes and begging them not to schedule Tuesday evening classes, but that's really impossible. So I know for myself, I'm a second year PT student. Next Tuesday night I have class from 4 to 6:30, which is right smack in the middle, and that's half of our treating PTs. But in terms of morale, if a patient doesn't show up, we really, really try to take that treatment team and make them the next treatment team for the next new patient that rolls through.
Also encouraging them to do those outreach opportunities, educational fundraising things, because the holistic vision is not just treating. Becoming a volunteer for vision is not just treating a client during a 4 to 6 on Tuesday.
Okay, we'll have a 10-minute break. I also wanted to let everyone know that I have raffle tickets. We're raffling off the door prize, which is